In the Central Valley, chronic wounds are common, especially for patients managing diabetes or circulation problems. But a wound healing center in Clovis is working to expand access to care that could help prevent amputations and improve patients' quality of life.
I had a tummy tuck, so my tummy tucks opened up. The scar on it opened up a little bit, so there was a wound. I was working with my plastic surgeon for a little while, and the things that he had me doing didn't work out, so my primary care doctor sent me to wound care here.
What started as a routine cosmetic surgery turned into a months-long struggle. Kelly Johnson's wound kept growing and no treatment seemed to help.
So it started out when they took my drains out, fluid started coming out of the incision and the hole just got bigger and bigger. It wasn't huge, but it was concerning because it wasn't changing, it wasn't closing. I would say now today it's almost all the way healed.
Her experience acts as a reminder that chronic wounds can happen to anyone and can start for a broad range of reasons.
It's always easy to take care of a patient that's fairly healthy and comes in with a new wound, but then we see people with the chronic disease process like diabetes, and that impedes their healing. That prolongs their illness and the chronicity of their wound care.
Dr. Reddington is a medical director for the John C. Harris Wound Healing Center at Clovis Community Medical Center, an outpatient center offering advanced wound treatments, hyperbaric oxygen therapy, and ostomy care.
When we were in a space that was more confined to 4 exam rooms, we could only offer care to a certain number of patients per day. So we're hoping to expand our services to not only be able to offer more care to people that are paralyzed or on a gurney because of chronic problems, but also just the number of people we see with increased complications from diabetes.
The center is expanding to meet rising demand, treating everything from diabetic foot ulcers to post-surgical wounds like Kelly's.
We know that if you're a diabetic and your glucose is not well controlled, you're at higher risk for amputation. Once you start having amputations, you're at higher risk for further amputation or bone disease or bone infection.
And by expanding her team, Dr. Reddington hopes to catch wounds early and stop the downward spiral before it leads to amputation or worse.
We're here to provide that assistance with the wound healing. It's not just the vascular doctor, it's not just your endocrinologist. We want to be part of their care team. We want to be an added member that provides value.
And for patients like Kelly Johnson, it's a second chance to heal.
Working with Dr. Reddington has been amazing. From the moment that I came in and that I met her, she was welcoming. She took time with me to ask me questions, not just about, my wound and the things that I had gone through, but about me personally and my experience so far.